Okay, right. Let's make a start. Good afternoon, everyone, because it has just gone 12 o'clock. It's really good to have you join us for this final webinar in the current Impact series, Growing Workforce Capacity and Capabilities for System Leadership. I'm Jonathan Webster. I'm Professor of Practice Development and Co-Director of the Impact Research Group within the School of Health Sciences at the University of East Anglia, and I will introduce my co-presenters to you in a moment. Just to say that this webinar is being recorded and will be available on the YouTube channel once we've completed the webinar. Can I ask you, please, if you're attending, to turn your cameras off? Please, can I ask you also, if you've got any questions or comments that you would like to pose or like to have posed at the end, that you put them in the chat box. And my colleague, Professor Sally Hardy, is going to be overseeing or managing the chat box for us. So thank you, Sally, for that. We do anticipate at the end of the webinar for there to be about 5 minutes for questions or comments. So, you know, really, please do post any thoughts or questions that you might have. It's really interesting that this webinar is at the last of the series because we are undergoing a huge amount of system change with ICBs coming into being from the 1st of July. Lots of discussion, as I'm sure we're all aware of, out in systems, regions and nationally about NHSE and HEE and NHS Digital coming together. And also at a time when we're thinking about system leadership, at a time when we know from across our provider settings how much pressure people are under and what that sort of looks and feels like. So when we're talking about system leadership and building capacity and capability, that is very much within the context of systems changing at many different levels. So I suppose what I would say is also thank you for finding the time to join us as well today. We do absolutely understand you know, what our systems look and feel like, so it's good to see you all. Can I have the next slide, please, Bianca? So our presenters today, so I've already introduced myself. We have Maurina, Barron and Paulette Lewis, both from the Caribbean Nurses and Midwives Association. We've got Saffron, Rolp-Willis from Health Education England, East of England. Emma Wakelin is going to be joining us from Norfolk and Waveney ICB. And we've got both Beverly, Chilson and Claire Whitehouse from the James Paget University Hospitals NHS Foundation Trust. So thank you to my co-presenters again for contributing to our webinar today, but fundamentally bringing your expertise as well to share with us. It really is appreciated. And you'll see at the start of this webinar, we're using I'm using imagery of trees. And the focus is very much around growth and development. So using images of trees felt to be sort of quite appropriate for us. Can I have the next slide, please, Bianca? So the context in which we will consider system leadership is constantly moving and changes. And as we've already alluded to, we absolutely recognise the challenges at this current time. So we know that our health and care systems are experiencing unprecedented pressures, and those of you within provider organisations are absolutely living and breathing that. We know that populations are changing with an ageing population and people living with complex and long-term conditions. Increasingly, which is something that I think we should be celebrating because it is absolutely reflective of improvements in care and treatments and therapeutic interventions that people have access to. We know that funding is hugely challenging, and we also know the key elements around sort of workforce and the impact of workforce and vacancies across our systems. But looking to the future, what we know is that there's a real need to break down barriers through better integration. And that has the real potential to deliver high quality care that achieves better outcomes and uses resources more effectively for people and for communities. And we also know that effective system leadership relies on a number of behaviours and capabilities which can be grouped together under these 4 domains from the NHS Leadership Academy leadership framework. So firstly, innovation and improvement, relationships and connectivity, individual effectiveness, learning and capacity building. And this has come from the Social Care Institute for Excellence. Next slide, please, Bianca. So we frequently talk about healthcare, but the focus when we talk about building capacity and capability through system leadership is absolutely about working across systems encompassing health, social care, the voluntary sector, and fundamentally people and communities. And the leadership model for health and care continues to shift from one that is traditionally hierarchical and focused on single organisations to one that involves leading across a whole range of organisations using influence rather than management direction. And if we look at this slide, we can see a number of skills and a skill set and what is needed for system leadership. So pulling out some examples, so you know, the traditional model of focusing very much around organisations and being very organisational looking and organisational centric moves from a sort of power centred base to a base of system leadership that seeks to influence. A focus on individual organisations moves to a place-based whole system approach to leadership. An organisational focus approach to leadership very much can be professionally driven, whereas system leadership is centred on being person-centred, inclusive and co-productive with people and communities. And again, if we think about the shift from a focus that is being very much on short-term task focus to a long-term focus on transformation of a whole system. And I'm sure certainly for many of us who have worked across systems and been part of systems for a number of years, you know, if we think about the patient, the person pathway, what we recognise is the importance of pathways being connected and how a few focus around system pathways actually joins each part of a pathway, a clinical pathway together that is seamless for the person, that enables far better joined up and coordinated care. And if we think historically as well, a focus around single organisations can be very much around being competition and conflict prone to actually system leadership is very much about surfacing conflicts, being solution focused, consensus seeking and building a shared vision and narratives for what system leadership is actually about. Next slide, please, Bianca. So again, this slide makes reference to the NHS, but we would argue that collective and inclusive and compassionate leadership stretches across the whole system, encompassing health and care and voluntary sector, in which people and communities are absolutely central. And this, you know, sort of collective, inclusive and compassionate leadership means shifting from traditional command and control structures and heroic leadership towards a model that distributes leadership to wherever expertise, capability and motivation sits within organisations. So it is really sort of seeking out opportunities to optimise the leadership skills of all that will equal better outcomes for people. Next slide, please, Bianca. So in preparing this webinar today, we're going to view growing workforce capacity and capabilities for system leadership through an interrelated prism. And we've used this imagery of a prism because if we think about when we look into a prism, we will see different colours, different shapes and different patterns, depending on the perspective we look at the prism through, and also where the prism is held. So if the prism is in sunlight, we will see multiple rays of colour and light coming from that prism. So really thinking about sort of building capacity and capability for system leadership, it will be dependent on perhaps where we are and which element of the prism we're looking through. Please excuse the clock chiming in the background. And we've focused very much our webinar today on, firstly, an international perspective, which will be led by Maurina and Paulette. We'll then focus on a regional perspective led by Saffron, a system perspective led by Emma Wakelin, and an organisational perspective that will be presented by Bev and Claire. And we will really look at growing system workforce and the capabilities and capacities through this prism. So we will give different perspectives. So can I hand over now to my two colleagues, Maurina and Paulette, who will give us a sort of international perspective. Thank you.
Thank you very much, Jonathan, for inviting us to speak, which we're most honoured to do. Good afternoon, good morning, good afternoon, good evening, wherever you're joining us from. It's a pleasure to be speaking to you all. Just to introduce myself, my name's Maurina Barron, and I'm the Vice President of CNMA. Next slide, please. Now, as we can see, and as we have experienced, there's a worldwide mobilization of people in relation to healthcare. And we see the efforts from the World Health Organization, the International Confederation of Nurses, as well as the International Confederation of Midwives. And importantly, in relation to what Jonathan has already said within the leadership model, the leadership has to start on a global level because healthcare professionals are working across the board. And one of the ways that we ensure that the people who are moving from all over the world is the representation that comes from the diaspora group, such as ourselves. And Paulette and I can say to you that we have worked with several diaspora groups, whichever part of the world that you're from. But CNMA here is representing the diaspora group. So just to tell you a little bit about CNMA, it's the Caribbean Nurses and Midwives Association, and our vision is to be the voice of Caribbean nurses and midwives in driving change towards improvement of health and social care, education, workforce, and policy development. Although our vision is to work with Caribbean healthcare professionals, we do not turn anybody away. We will support anybody from any of the other countries in terms of our vision. Our objectives is to provide strategic leadership to support and advance nursing and midwifery professionals within career opportunities, to be inclusive by engaging a broad range of partners, members, and perspective groups. Develop a framework to empower members to improve diversity, inclusion, equality, and health inequalities across the healthcare systems, and to increase the development of the next generation as future leaders. So we are very keen to participate and to share the experiences of working alongside Jonathan and people like Sally and everybody else who have been invited to speak here, in terms of the leadership models that we could be encouraging our membership to be using. Okay, next slide, please. So CNMA, our purpose, we've already commented about, and the objectives. Representation, we are here to represent not just the recruits that are coming from across the Caribbean, but our members, our Caribbean nurses, midwives, and health visitors who are actually practicing here in the UK at the moment, because we know that the transition from one country isn't easy. So our role here is to support them as much as we can. And that we have been doing relentlessly in terms of the pastoral support that we've been giving, education and development workshops that we have been putting up, and to be protecting and supporting them from the level of vulnerability that they are exposed to. And as you know, moving from one place to the other, they're vulnerable, they're lonely. So, there's a safeguarding issue here that we are keen to address as well. So this is just a clippet of what CNMA does. Okay, next slide, please. And within our presentation, Paulette will pick up on a lot of the key things around workforce development and leadership. It's looking at issues around global recruitment, the breadth of the staff shortage, the issue around that, and staff shortage has been a key thing here in the UK from the Windrush days right up to now. I'm looking at the strengths and weaknesses across the global systems, transitioning to alternative workforces, looking at ethical recruitment, which is a key issue, looking at impact and sustainability, workforce capacity and capabilities, and again, picking it up and relating it to system leadership, and overall, the role of CNMA as part of the capacity and capabilities module. Thank you. Next slide. So, like I said, our key role is around giving pastoral support to our internationally recruited nurses and midwives, specifically from the Caribbean. But again, like I said, we don't turn anybody away. We've got a list. We've got at least 21 other diaspora groups that we work closely with as well. We received some funding from the Florence Nightingale Foundation and the NHS Workforce to develop our pastoral care program. And this we did in consultation with our membership, broad membership, some of the trust, interested parties, and so forth across the country. What we did, having developed a package, we collated some findings from some of the workshops that we got and the feedback that we got from the international recruits. We considered the implications and the lessons learned, and we considered how to escalate it. And that we did in the form of reporting back to Florence Nightingale, having conversations with the key leaders within the NHS system, people like Duncan, Ruth May, etc. And we are constantly evaluating. Paulette, in particular, does a lot of one-to-one, and we actually generate workshops and webinars, and in order to elicit some of the key challenges that the recruits are facing. Okay, next slide, please. And some of the key themes when we evaluated the pastoral care programs, elements of it, whether it's the workshop or one-to-ones, etc., those are the recurring comments that were coming out of it. The need to engage in the onboarding process. A lot of our recruits felt there wasn't enough being done, and it was important that a cohesive, strong, structured onboarding process should be in place at all the trusts where they're working. Looking at the environment and of the understanding of the international recruited nurses. So looking at the environment they're coming from, looking at the environment they're going into, and understanding the individual themselves. Issues around equality and diversity, lack of understanding of the HR policies, being treated differently, where they couldn't understand whether it's their accent or their cultural background, etc. Ward orientation, they felt that was very limited and could obviously be strengthened. Dealing with complaints, acceptance of rejection, the language, communication, culture and behavior, in particular, culture and behavior. Some of the recruits commented that they'd come in, they'd say good morning to their colleagues, and their colleagues just ignored them. And this is something, as a Caribbean person, you grow up with from a child. You have to learn to say good morning when you meet people. And looking at overall career development and so forth. Those were the key themes that were coming out of our feedback, our engagement with the international recruits. Next slide, please. So some of the actions to support the workforce capacity and capability for system leadership based on our work with the recruits it's to be looking at developmental programs, not just for the recruits, but for some of the staff who have to be supporting the recruits in the clinical area. We had webinars, we've had discussion, we've had safe space reviews. We've discussed things like the onboarding process, and again, we've had webinars around that. We have developed a pastoral care booklet, and we, if you're wishing to see that, I'm sure we can send you the link that you can have a look at it. Health and well-being booklet in particular, because a lot of the recruits were sharing some of the challenges that they faced in regards to mental health issues, in particular, the loneliness, isolation, depression in some instances. Social interactions. We took them on a coach trip. We took them on a guided London tour, which they absolutely loved. And looking at sessions on culture, behavior overall. Our key focus has been around collaborations, not just with the recruits, but the trust. We have engaged widely, in particular with leads, where we have also been invited to do a workshop presentation specifically. So we've been engaging widely, and again, that will be picked up in subsequent slides. Next slide, please. So this is where I hand over to Paulette, who will take on board the cultural transitioning and talk a bit more about systemic leadership.
Good morning. My name is Paulette Lewis. I'm the president for the Nurses and Midwives Association UK. I'll just quickly go through the cultural transition and pick up on system leadership. Most of what Maurina spoke about, that tells you about the leadership within our organization and the leaders with whom we've been working with to make this possible. So as you know, the systemic leadership and leadership is the ability to influence and prepare and to take accountability of making sure that we achieve what we really want to achieve. And that's really very important, working both from a local, national and international level. So we need leaders who are prepared to be accountable and to look at culture and behavior, how we change that within organizations. And from the discussions we've had, if we haven't got the right leaders with transformation leadership styles, then we'll have an issue in how we change behavior and culture. So it's really important as we work with different groups across the sector and internationally that we work with leaders who do understand the principle of being an authentic leader, a transformational leader, and one who embraces others to make the change happen. So that's really very important. And as for us as an organization, we work very much in developing at every level future leaders so that they themselves, from a succession planning point of view, can work in making the transition. I think the system leadership or the leaders we have out there today needs to understand the issues fairly well in terms of building the capability and the capacity, which we talked about early on as an organization. If we're to make this happen, it just won't happen on its own. So one of the key factors I'll just touch on here is about the cultural transition. So cultural behavior and how we behave and our culture is one of the hardest things to do. Therefore, having that type of leadership which we require will make that happen. So we need to have the skills and training and development to make behavioral changes happen. And we need to ensure that the organizations or the diaspora organization, even as we sit around the table today, understand the importance of cultural transition. It's not a one-way thing that you think you're preparing for those coming from the diaspora organizations internationally to come into your organization. So how are we preparing ourselves to understand the culture, the behaviors of those people coming in to work with us? If we're to continue to build the capability and the capacity with, then we need to be looking, how do we use our system leadership across the piece to develop that? So I think it's very important from a point of view to ensure that we do have leaders that understand system leader and cultural transition. It won't work, and if we're to build that, then that's very important. Next slide, please. So our system leaders, we looked at, so we are system leaders, and we are the system leaders that we're working with. How do we engage? How do we influence? How do we work in collaboration, as we talked about? And how do we let them understand the issues that we are facing here within the UK? How are we working with the diaspora organization, preparing them through the leadership within organizations? We need to recognize their needs. We need to be influencers. And one of the things we're doing is actually working with heads of governments. Again, their leaders understanding the need to work with us in order to make things happen. So CARICOM, like all the Caribbean islands, heads of state, we work with them, the G8, Nursing Now, RCN, many other organizations, because in work with us and understand education development, then they will help in the sustainability of our international recruit nurses who are working within the system. Next slide, please. So if we're to expand the NHS healthcare system, there's something we need to stop and work together from not just from a health point of view, but within the community. Do we understand what we need? How are we going to engage? And how do we build? So we can build, but how do we sustain? How do we keep those people? How do we value? And that's, as I said before, from a cultural transition, it's not a one-way street. It's about how do we prepare our own leaders at every level to be ready within the healthcare system for accepting. So our leadership style and approach is very important in how we move forward. Transformational leadership, I think, is very important. The skills and competencies as leaders and organizational culture is very important. As I said before, culture and behavior is very important. And part of the problem we have, if we want to build capacity and sustainability, we really need to, as leaders, systemically look at our culture and behavior and our acceptance of others, and look at a global model. How can we work differently? Innovation, creation. Next slide, please. So we've been doing a lot of work with other organizations, which is very important. No man is an island. We cannot do this on our own. We need to work with other organizations to collaborate to ensure that as leaders, we come up with creative and innovative ideas to make things happen. So you'll see a list of different organizations here, the collaborative organizations from the NHS, Florence Nightingale, University of Exeter. You know, there's just so many different groups we have to work with, because I think it's important for us to share and learn from each other in terms to build the capability and the capacity we require, and to learn from each other. Next slide, please. So I'll just leave this. I won't go through this because of time, but global health. So the impact for global health, there's an imbalance here. And this is why it's important for us as leaders to understand the issue around the leadership styles we have and how we work with each other to address that across the world, globally, because there's an imbalance of how we're looking at capacity and capability. You know, how long will we continue international recruitment, and what will that mean in terms of the rest of the world? So what are the innovation and creation and the co-productions can we do in helping other organizations and other countries and diaspora groups to build their own, so that we can address the inequalities of health? And if a pandemic should happen tomorrow, how would we manage that if there's an imbalance in the global health care system? So capabilities and capacity has to be right across the globe, not just in one place. And then that will build sustainability. And that will also address the ethical recruitment we talked about. If we look at it together from a global perspective, global recruitment is you know, people will migrate, we will move around. But how do we do that to strengthen and look at strengthen the global issue, and also look at the weakness of the system? So I think this is something we need to do as leaders at every level of our organization and across the system. Next slide, please, I think. So Our capability is around planning and building capabilities, which we are doing now. New ways of working, which we have through our pastoral care and working with other organizations have been doing. And we're trying to develop the workforce, because it's no point bringing workforce in and then they leave. So how do we maintain the workforce we have? And looking at different models of working. And I think one of the big things we have to do in capability and capacity is work very hard around the sustainability of what we have, how we treat people, how we work with people. Are we authentic leaders? Do we listen? Do we care? Are we empathetic and compassionate? And put all of those together, then we'll be able probably to address the issue around the workforce capabilities and capacity. Thank you. Next slide. Thank you. And I will pass you on to Saffron, who will then give her presentation. Saffron?
Thank you very much, Paulette and Maurina. Thank you for that presentation. So good afternoon, everyone. And my name's Saffron Rolp-Willis, Workforce Transformation Manager in the East of England team at Health Education England. So next slide, please, Bianca. Thank you. So, as I mentioned, I work in the workforce transformation team, but what do we mean by workforce transformation? So, from a regional perspective, we're supporting both our systems, our ICS systems, and also our organisations to support with workforce transformation as being a key enabling function to support the development of workforce responses, not only to our healthcare workforce now, but also in the future. And how we're doing this is, next slide, please, Bianca. Around 3 pillars. So from a regional perspective, hopefully this picture shows some of our key areas that we're focusing on from Health Education England and the support that we're giving to our 6 emerging ICB systems that we have in the East of England. The first pillar there around building capacity and capability, which I'll talk about in a bit more detail. Secondly, around integrated systems development, so supporting our systems to work across health and social care and to support that integrated workforce planning and support at that system level. And then thirdly, around workforce improvement and innovation. So how can we do things differently? What are the new ways that we can work across our region, and what are the new roles that we could do and new ways that we could work differently? And I apologise for some of the acronyms that are in this slide. I noticed this morning that I'd left some of those in. But in terms of the 2 boxes there, I wanted to highlight the drivers. So what are the factors that trigger some of this innovation and the work that we're doing? So we have there a range of national policies and priorities. And I noticed some of those are being put into the chat in terms of some of the policies and areas. Also, some of our regional workforce priorities that we have in the East of England. So the mental health workforce and also cancer and diagnostics workforce are key areas that we're working in among many others in terms of supporting some wide-scale workforce transformation in the East of England, as well as our local workforce challenges that we have across each system. In terms of our enablers, so what can we be using to support our workforce transformation through those 3 pillars? Well, from a Health Education England perspective, our main focus is around education and supporting our NHS organisations in terms of providing the right workforce with the right skills. So we have a number of initiatives around upskilling, and we have our CPD, which is our continuing professional development, and also our workforce development funding, which are key programmes which can support ongoing development of our workforce to make sure we have the right people with the right skill mix. We also have our workforce transformation team work streams, which is around, as I mentioned before, looking at the workforce for today, how we bridge that and bridge any gaps, and then our workforce for tomorrow as well, which again is aligned to talent management, leadership, OD, and then of course workforce planning and modelling as well, which is a key area for HEE. Next slide, please. So in terms of the building capacity and capability pillar, which I wanted to focus on today with the theme of this webinar, in terms of how we're supporting from a regional perspective, is in terms of supporting the upskilling of transformation mindset and principles. So the understanding of what workforce transformation is, the understanding of change management, and why we need some changes within across health and social care in the east of England. So supporting with some e-learning, also some masterclasses and workshops to support that understanding and learning, to build the capacity and capability around workforce transformation. And then the middle box there is in terms of some more advanced support that we've been giving to the people directorates within the region, but also to colleagues that have signed on to our workforce planning masterclasses, and also some of our HEE STAR transformation workshops. And I'll talk a little bit more about the HEE STAR in a moment. We also have a key area that we're focusing on in terms of some succession planning and talent management around workforce planning and population health management. And we're doing this at a very strategic level because we've identified that we have some skills gaps and some shortages within workforce planning and also population health management across the east of England. And for us to truly work at that system level with integrated workforce plans to look at our future in terms of where the gaps are, to change our workforce for the better, we need to have really good workforce planning and population health management to support that. So those are key programs that we're working on at the moment in terms of building our capacity, so with support and additional resource going out into the systems, and also the capability and making sure that it's an integrated approach. So another example of how we're supporting that from a regional perspective. How we add value, and I wanted to really emphasize here the relationships. So it's really important that we're not doing this in isolation. So obviously Health Education England, we work very closely with our partner organisations across NHS and social care in the east of England. We also work very closely with UEA and our other HEIs, as well as colleges, health and social care academies, and of course our colleagues in other arm's length bodies in NHS E&I and public health. So it's really important that when we are working on initiatives, especially at a regional level, that we try as much as we can to be collaborative and joined up with our approaches. Next slide, please. Thank you. So this slide here shows some of our enablers that we use as part of our HE STAR model, which is a model which we promote to use around conversations of workforce transformation. And you can see there 5 key areas which are important to consider. So supply, in terms of identifying current and future workforce, as I mentioned before. Upskilling, which is a really important area in terms of looking at, do we have the right capacity, capability within our workforce? What do we need to do if we're changing skill mix in terms of increasing or supporting that future workforce? New roles, which again is another important factor in terms of looking at what could we do differently. So what new roles could we bring in? And we have some really good examples across the east of England of some hybrid models across health and social care, and also some models of colleagues in mental health working in primary care. So lots of ways of bringing that multidisciplinary way of working so that we can connect and work in different ways. And I think through the pandemic, we've also, because we had to work in a very high pressured operational way, that's also showed us that we can work in different ways, and has allowed that kind of exploration of new roles. And training nurse associates are another example of some of the new support roles that we have brought in to the workforce. New ways of working, so again linked to new roles. How can we do things differently? How can we streamline? How can we be more effective? How can we be more efficient? HE also has some additional support tools around clear and workforce redesign and workforce planning, to look at certain areas to see how we can be more efficient. But we also see some initiatives as well around digital workforce and virtual wards, which are coming in again to look at new ways of working and doing things. And then last but not least on here is leadership. And this is so important because in order to drive all of these initiatives that we would be looking to put forward for the workforce transformation, we need to ensure we have good leadership in place. that, and as Paulette and Maurina spoke about earlier, the culture and the organisational development and design that is needed. So we really need to ensure that we have the leadership in place to drive the new behaviours and new ways of working that we need. Next slide, please. I'll just quickly race through this one because I'm just conscious of time, but I referred to it earlier. So the HE star, so you can see on each of the tips of the star there, the 5 key areas that I just went through on our HE website, and there are links in this presentation. I can also put them into the chat as well. We have lots of examples of service redesign or workforce transformation linked to areas of the NHS and across social care as well. So there's a directory. So I really encourage people to have a look at that. But again, this is another example of a tool, techniques that can support those conversations or that exploration into areas of workforce transformation. And of course, it links to building capacity and capability as well. Next slide, please. Actually, if you could skip to the next one, Bianca, that just goes into the star in a bit more detail. Lovely, thank you. Another couple of tools that we have from Health Education England, which can support these both regional, system or organisational conversations, is our MDT toolkit. So this is our multidisciplinary toolkit, which is a really helpful toolkit in terms of looking at how to have those multidisciplinary team meetings and ways of working, to really look at our ambition to have that one workforce working across health and social care, but also across different professions and disciplines. And another one I've linked there is the Roles Explorer. So we have lots of sample job descriptions and also person specifications, which looks at the different skills that are needed for certain roles. So again, for colleagues that are looking at doing things slightly differently, looking at how they can build capacity or capability within their teams or their organisations, really encourage them to have a look at these tools and utilise them. Next slide, please. And that it just goes into the MDT toolkit in a bit more detail. And you can see there the 6 key enablers for successful MDT working, and we'll link to this so you can see that in a bit more detail on our website. Next slide, please. Thank you. And just lastly, just one more example that I wanted to share around some of the ways that we've been working from a regional perspective with our organisations is around a workforce planning masterclass. So we have recently launched an 18-week workforce planning masterclass series, which would look at an area of the workforce where we know that there is an area that we want to work on in terms of workforce transformation, and we'd go through the 6 steps of workforce planning, which again is another HE tool and also widely used by other organisations as well. So in terms of defining the plan, mapping the service change, defining the required workforce, understanding workforce availability, then developing that action plan, and then implementing, monitoring and refreshing. So at the very minimum, we're saying that that process would take 18 weeks to go through, and then you've obviously got the delivery of the plan as well. But we have a number of tools, techniques and resources from HE that can be used at every step of that stage when looking at those workforce transformation projects and programmes. Next slide, please. Thank you. So I've just, my last couple of slides is this one from HE, which has just got the links which I referred to, but I can also put them in the chat. And then Bianca, my last slide, please. I also just wanted to link from our colleagues in NHS E&I, the East of England Leadership Academy. They have a whole suite of resources around system leadership on their website. They also do a number of masterclasses and they have some courses as well. So I wanted to just make sure that they were linked there, and again some really helpful resources for colleagues to use from that regional perspective. Lovely, thank you. So that's all from myself. I'd now like to introduce Emma, who is the Associate Director of Workforce Transformation in Norfolk and Waveney, to talk from the system perspective.
Thanks, Saf. I'm not quite sure how I can follow the presentations that we've had so far, because it's been really great and interesting. So thank you, guys, for setting the scene. I'm here today to take us down to an integrated care system level. So I'm here to talk specifically about Norfolk and Waveney as a system. So if we can go on to the next slide, please, Bianca. So what I wanted to start with is just to set some context for those of you that live and work in the Norfolk and Waveney system, and for those of you that aren't so familiar. As Jonathan mentioned in his opening state, integrated care systems have been given their legal status from the 1st of July this year. So what that means is that it's resulted in a new integrated care board, so NHS Norfolk and Waveney, which replaces our CCG, and also an integrated care partnership. So lots of new organisations and lots of mandates coming through in terms of the ambition and responsibilities of systems, which is really exciting. And just to add, this isn't, we're not starting from scratch from the 1st of July. We've been working very closely over the last couple of years, in particular as a system, to improve services and provide more joined up care for our local people. So the image here just gives you an overview in terms of the size and scope of the partner organisations that we have across the system. Just to add to that, our workforce is around about 50,000 people, delivering both health and care services to our local population within Norfolk and Waveney, which I think is really useful to have in mind when we're thinking about how we achieve our ambition of greater systems working and leadership. When you factor in the number of organisations, you factor in the geography, and you factor in the number of people living and working in our footprint. So as I mentioned, we'd already received and achieved a lot by working in partnership across the system, which again has really been strengthened by our response to the pandemic. And the changes have been possible by bringing together different organisations, different experiences and different individuals. So from our NHS hospitals through to our general practice surgeries, our mental health and community services, but also thinking about some of those non-NHS services, so our local councils, care homes, voluntary and community organisations. Really important that we start to deliver that leadership competency and capability collectively. So just in terms of the Norfolk and Waveney system, we have 3 priorities for our people. So it's to make sure that people can live as healthy as life as possible, to make sure that people only have to tell their story once, and to make Norfolk and Waveney the best place to work in health and care. So in order for us to deliver against those priorities, we need to continue to develop leaders with systems thinking mindsets, attitudes and behaviours to support those new ways of working. And really importantly, building those trusted relationships across our partnership. And given the size and scope of our integrated care system, I think it's really important to realise, as we've seen from some of the presentations so far today, that leadership is grown and led by individuals, teams and groups. So the role of the integrated care board as part of the system is to provide that strategic direction, empower our people, and to bring partners together with the tools, resources and conditions needed for them to deliver effectively through organisations, through place and across the system. So if we could have the next slide, please, Bianca. Thank you. So what's the ask from a system perspective? So we're very much guided by the long-term plan, but also the mandates coming through in terms of integrated care systems. So again, opening up the conversation, the ambition beyond the traditional NHS focus. So the ask of our leaders, I've kind of refined down to three core things. So it's to deliver an ambitious and transformation agenda at scale and pace. To take a long-term view in terms of planning and prioritising certain areas at any time, and to prioritise the interests of the system over those of any individual organisation, big focus on prevention and health population management, and to think about how we address the wider determinants of health. So huge agenda and really important. And it's certainly, from my perspective, it feels like our feet haven't come off the gas in recent years with the pandemic, but also now thinking to the future. What does that look and feel like in terms of the catch up? So elective recovery programmes, greater emphasis on our broader population needs, and things like support for individuals' mental health really increasing rapidly. So we're continuing to see the need to do more, to do it more quickly, but also to do that together. So I think, from my perspective, looking out for each other is really important now more than ever. So a real focus on resilience and wellbeing as systems leaders is really key to the work that myself and our team do. And I think the references made by Maurina, Paulette and Saffron, in particularly with regards to innovation and learning from others, at both a local, regional and national and a global scale, are really pleasing to hear, because I think, you know, thinking and doing things differently is what will make the difference going forward. And then just the following spring to mind when I think about systems leadership. So a bit of duplication from some of the theory and the thinking that Jonathan referenced at the start, but I think it's just really important to kind of reference those. So I won't go through them, they're on the slide there, but they're certainly the things that spring to mind for me personally when I think about my role as a systems leader and my role in to support the development of system leaders across our footprint. And then finally, just to kind of close before I hand over, I think that the task for the integrated care system and the integrated care board is really to develop that strategic leadership vision for the future. So to support that vision and direction, we've got a number of things that we are developing, we've got in development, and we're refreshing as we go along. So We Care Together is our integrated workforce strategy. So that really emphasising the importance of leadership at all levels across boundaries, health, social care, voluntary sector, and within our local communities. And we're actually refreshing that strategy this year. We are developing a clinical and care professional leadership strategy. So this is a national mandate for all integrated care systems, being led by our newly appointed medical director, Frankie Swords, and launching a range of system development. So what you would traditionally look at as organisational development programmes, but on a system footprint, but for our senior leaders across the system. So those working as part of our ICS exec, our ICB exec and board, and those based out in place footprints. So I'll pause there. Hopefully that's been helpful in terms of kind of the system perspective. And I'll hand over to, I think we've got Beverly and Claire. We've got Beverly and Claire with us. I'll hand over. Thank you.
Thank you. So hi, I'm Claire Whitehouse. I'm Senior Nurse for Nursing, Midwifery and Allied Health Professions Research at the James Paget, and I'm here with my amazing colleague Bev. I'll just let Bev introduce herself.
Hi, I'm Beverly. I'm the Integrated Therapies Clinical Lead at the James Paget. And I think before I go any further, I just want to reference to what Emma just was talking about. When I say integrated therapies, it is not just about what we do at the hospital, but we're very much linked with our community partners and our therapies out in East Coast community healthcare, because everything that we do has an impact on them and vice versa. So we're integrated in more ways than one. Thank you.
Thanks, Bev. So we're going to talk to you a bit about embedding a research ethos at our organisation across the NMAHP professions. And if we think back to the PRISM and the different dimensions that Jonathan mentioned at the beginning of this webinar, and that everyone else has kind of mentioned or referenced throughout, we can see that building system leadership is definitely not just a course on leadership. It's actually about how we truly embed it at ground level. It's about finding solutions to build capacity and capability that work for your service and your trust. So Bev and I are going to take you through how we view system leadership for our own approach to build capacity, capability and confidence in embedding research and our embedded research model across the NMAHP professions. Next slide, please, Bianca. Thank you. So for this section, I just thought I'd kind of give you an idea about where we've come from and a bit of an overview first. So kind of embedding that positive research ethos and ultimately increasing research activity, it takes time and it takes a lot of effort, but it's absolutely worth it without a shadow of a doubt. The benefits that we're seeing for patients and for staff are huge. So we just thought we'd sort of talk you through how we've got to where we are now. And the first thing for us is about shared vision and values, so that top point there in the yellow. And this might be really, really obvious, but it absolutely has been important to us, and we wouldn't have been able to get anywhere without this. And I think we really just wanted to point out that actually it begins with belief in yourself and in others, and being able to trust your gut and your colleagues. That for us is absolutely, we feel very supported by each other because of having that belief in ourselves and in each other. And a key component to this is really around the value. And we're not just talking value in terms of pound signs here, which I know that a lot of people do often think about research and innovation and bringing in that money. But actually, we're talking about value around clinical academic research roles, what they can bring. So the recruitment, the retention of staff, the celebration, and all of the excitement that comes with that, and really creating that positive research culture, as well as improving patient safety and outcomes, and staff safety and outcomes too, which is great. But it's really about valuing our staff at a time when they feel really undervalued. So to be able to do this, we've really looked at the infrastructure over the last probably 18 months or so, and this is very much around audit, research, quality improvement, and service evaluation, and having to build some of those teams because some of them didn't exist before. The commitment of the trust for us to do this has been of absolute paramount importance, because without the belief and trust from them to allow us to do this, we wouldn't have been able to kind of forge some of this progress as well. Accessing initial funding, so through things like the HE bridging programs for some of the academic support and programs as well, has been really good. Collaborative working with other organisations, so the Impact Research Group at the UEA is one, but also some of the other clinical organisations such as Newcastle University as well for our embedded researcher model. And although we touch on the embedded researcher model, we don't show the whole model here, so I'll pop, or possibly Sally could pop the link to our paper in the chat, then people are very welcome to have a look, and we're always happy to chat with people about it as well. And I think really it's once you get that starting point, and as Bev put it once, the support of a research dude to kind of guide the people, the teams and the departments in how to do this, that's when you can really start to embed. And for us, we are very much working across nursing, midwifery, AHPs, medics, everybody. And it's about that integrated and bringing people together, kind of creating a team without boundaries is the main thing that we would say there. And then really it's about making it happen, and how do we do that? And for us, it's very much been about accessible training, supportive education, and this is for everyone at all levels, regardless of banding, regardless of title and roles, and it's the formal and the informal. So formal things like NHR clinical practice training, consent training, quality improvement methodology training, all of these kind of things, but also that informal aspect as well, the brainstorming, the knowledge sharing, that kind of crossing professional boundaries and just looking at things in a slightly different way. And then we've got things, anything from embedded researchers, like we were saying. So it's about growing our own staff in capacity, capability and confidence, and supporting them within their roles. And in the embedded researcher role, we have dedicated, clear research time, which may also include the other methods of critical inquiry like QI and evaluation as well, because what we've seen is that one definitely leads to the other, and vice versa. I know I've mentioned the support from the trust, but actually in terms of making it happen, this is not a lip service support. This is real, true support. When we need anything, we can have those conversations. It's from the non-execs, it's from board, it's from the directors of nursing midwifery, the associate director of HPs, everybody. And it's about really, really supporting others to develop their confidence in the other types of methodologies as well. So, for example, in maternity, we've seen that research has led to evaluation and QI activity. And in therapies, as Bev will speak about in a minute, it's grown from a bit of a mixture of both. So it's kind of demonstrating back to that value, the value of all of these things on each other and valued equally. So I'm going to pass you over to Bev for the next slide. And Bev's going to talk you through the therapies example.
Right, thank you very much, Claire. So in integrated therapies, we needed to do something differently. And with the leadership of Claire in the research element, we were able to add our embedded researcher into our department, which has just proven so beneficial for us all. So if you can click for me, please. So basically, we start our career using evidence all the time. Evidence-based practice is everything that we learn throughout our training and also when we start practicing. And so we have, basic things like standard operating procedures, policies, national standards, the things that we use every day to get us to what we need to do to deliver our clinical excellence. And then now we've added we're generating evidence. So local opportunities have allowed us to develop clinical leadership and opportunities that will contribute to research studies, both locally and nationally. So at our trust, we've been involved in hip helper. We're now involved in the FAME ankle fracture management, and also we have one of our dietitians involved in the renal phosphate trial. So we're a small team, but we're generating a lot of great national interest in what we're doing. And in addition to having our embedded researcher role, it's given an opportunity for self-designed studies that are meaningful and co-designed for the local health population. And that, again, impacts not just on our acute hospital and patients and staff, but also what is going on in our community. And then, of course, that embedded research then is driving forward and influencing is become an inspiration for our ward-based therapists and also our nursing colleagues as well at all levels. So we've got a number of projects that have been started. It helps staff to understand the importance of using and generating evidence. And we currently have a range of projects in progress and giving a sense of focus and purpose for acute therapists. And as Claire already said, in I don't want to say post-COVID world, because I think we're on wave number 5 at the moment in the trust, but it's giving therapists a sense of purpose. They're not just being discharge coordinators. They're now getting involved in projects that are meaningful for them, giving them a sense of value and a sense of respect, and generating evidence that is helping them to move forward in their careers and also in the therapy that they provide. So, and we're also finding that this is now leading to recruitment and retention of staff, which is really important for us. And if you could click for me, please. We've had in the last 6 months, 2 people come to choose our trust based on our embedded research role and what we're doing that's differently. And as you can see here, we've got a list. It's really impacting everybody from our support workers all the way through to professional leads and embedded researchers. And one more click for me, please. And 2 more clicks, another one. And then lastly, we are hoping that the evidence that we generate and also the support that we've got will help us also add advanced practice and consultant level therapists into our department as a result of what we're doing. So next slide, please. So in summary, having an embedded researcher leads to an embedded research culture and also improved clinical leadership. The key elements of the success for our embedded researcher role has been having the right person, the right support from our leadership and management, Claire being one of those, but also our trust, who has been extremely supportive and really engaged in making this happen, making it a priority. And also the trust are helping us to deliver on a vision. And that's been really important for us. Claire.
The other two key components really are about the integrated learning and the actual embedding of research. So we talk about the embedded researcher, but it's also about embedding the research culture, like Bev said. So, and for us, we've really seen benefit in that integrated learning and bringing our disciplines closer together. Challenging each other in a different way has been really beneficial, involving our patients in those discussions as much as our staff, and just kind of extending, like it says there in the green, you know, outside of our normal sphere has been really, really great for us. Everyone's involved, as Bev showed on the last slide, and that every project that we design comes from our population, whether it's staff, whether it's patients, whether it's carers, whoever it is. And I think that ultimately has been the key to our success so far. One more click, please. Thank you. And so really, it definitely for us about making it happen has been, it needs the vision, it needs the trust, it needs the support, and that's trust with the trust, the organisation, but also our trust for each other as well. The buy-in from everybody and the sheer determination to make it happen. And it is possible. And we haven't had, in case anyone asks, we have not had any extra funding to be able to do this. It's been the belief of people like Bev, Kirsty Cater, our head of midwifery, Paul Morris, our director of nursing, Jackie Copping, our deputy director of nursing, who have really, really helped to make this happen. So it's a massive team effort, but it's absolutely worth it. So thank you. And I'm going to tag back Jonathan because I'm very aware of the time as well. Thank you.
Absolutely. So thank you, Claire and Bev, and all I can say is wowza, really. It's really amazing. So two final slides here just as we finish. So these are themes that have emerged from our presentations, and when we all met as part of sort of the prep for today, we just started talking about what are those threads that run across building capability and capacity in system leadership. And these were some key points that we all felt sort of emerged in preparation for our presentations. And I won't run through those because of time, but a final quote by John C. Maxwell is there also about leadership is not about titles, positions or flowcharts. It's about one life influencing another. And certainly we've seen that today through these presentations, I believe, around sort of leadership in action. And final slide, please, Bianca. So thank you for finding the time in your very busy working days to attend this webinar. And I have to say thank you to the amazing presenters today. We have run a marathon in the heat in a very short time. I think we've actually done it in a record time. So well done to everyone. But thank you to all our presenters for really sharing some, fabulous examples. So as Sally has posted, if you've got any thoughts or questions about future webinars, then please do get in touch. And certainly any comments or questions that have been posed, we'll forward those on to the most appropriate person to answer. So thank you all, and we're 7 minutes over, so I think we've done pretty well. So thank you all.